Jolivette full drug information. 1. Generic name, drug class, brand name, drug forms, generic name, norethindrone, also called norethindrone in some regions. Drug class, progestin-only contraceptive, POC, synthetic oral progestogen. Brand names, Jolivette, US. Other brands include Micronor, NorQD, drug forms, oral tablets, 0.5 milligrams norethindrone, active tablets only, no placebos. Definition. Jolivette is a progestin-only oral contraceptive, mini pill. Unlike combined oral contraceptives, it does not contain estrogen. It provides reliable contraception when taken daily at the same time, making it a suitable option for women who cannot take estrogen. 3. Mechanism of action, MOA. Jolivette works through multiple mechanisms. 1. Cervical mucus thickening inhibits sperm penetration into the uterus. 2. Endometrial suppression reduces endometrial receptivity to implantation. 3. Inhibition of ovulation suppresses the luteinizing hormone LH surge. Though this effect is inconsistent, ovulation may still occur in up to 40% of cycles. Uses. Approved use, prevention of pregnancy, contraception. Unlabeled, off-label uses, management of endometriosis-related symptoms, menstrual cycle regulation in women intolerant to estrogen, treatment of abnormal uterine bleeding, AUB, in some cases. 5. Indication. Indicated for contraception in women of reproductive age, especially those who are breastfeeding, have contraindications to estrogen, e.g. smokers 35 years old, history of DVT-PE, uncontrolled hypertension, migraine with aura. Prefer progestin-only options. 6. Contraindications. Absolute contraindications, known or suspected pregnancy, current or past breast cancer or progestin-sensitive cancers, unexplained abnormal uterine bleeding, benign or malignant liver tumors, severe hepatic impairment or active liver disease, known hypersensitivity to norethindrone or formulation components. 7. Before taking this medicine, precautions. Medical history review, breast cancer, personal or family history, liver disease, including jaundice during pregnancy or prior COC use, cardiovascular disease or stroke, depression or mood disorders, irregular menstrual cycles. Other considerations. Can be started immediately postpartum in breastfeeding women. Does not protect against sexually transmitted infections, STIs, HIV, barrier methods needed. Fertility typically returns quickly once discontinued. How to use. Take 1 tablet by mouth daily at the same time each day. No pill-free interval, unlike combined pills. Every tablet in the pack is active. If started within the first 5 days of menstruation, immediate protection. If started at another time, use backup contraception, condoms, for 48 hours. If switching from another hormonal contraceptive, follow specific transition guidelines from prescriber. 9. Dosing information. Standard dose, 0.35 ml norethindrone daily. Duration, continuous, 365 days for a year. New pack started immediately after finishing previous pack. Special populations, breastfeeding women, safe, minimal effect on milk production. Adolescents, same dosing, but compliance counseling is essential. Renal impairment, no specific dose adjustment, but caution in severe cases. 10. Missed dose, overdose. Missed dose. If 3 hours late, take the pill as soon as remembered. No backup needed. If go 3 hours late or missed completely, take pill immediately, plus use backup contraception for next 48 hours. Vomiting, severe diarrhea within 3 hours. Consider as a missed dose, take another pill ASAP. Overdose, rarely life-threatening. Symptoms may include nausea, vomiting, breast tenderness, headache, or vaginal bleeding. Treat supportively. Chapter 11. Stop or avoid taking. If pregnancy is confirmed. If jaundice or significant liver dysfunction develops. If diagnosed with breast cancer. If serious cardiovascular events occur, stroke, MI, thrombosis, though risk is lower than with estrogen-containing contraceptives. Now 12. Side effects, common, mild. Irregular bleeding, spotting, amenorrhea, no periods, breast tenderness, headache, dizziness, nausea, weight changes, mood swings or depression. Less common but important, ovarian cyst formation, acne or oily skin, decreased libido. Serious rare, breast lumps, possible malignancy, jaundice, hepatotoxicity, severe headache or migraine with focal neurological signs, thrombosis, rare but lower risk than COCs. 13. Vital information. Timing is critical. Effectiveness significantly decreases if 3 hours late. Efficacy, typical use failure rate 9%, perfect use 1%. No estrogen risks, safer for women with cardiovascular risk factors, smokers, or postpartum. Return to fertility, rapid, usually within 1 to 2 months after stopping. Backup needed, with missed pills, GI upset, or enzyme-inducing drugs. And 14. Other drugs that affect Jolivette. Drugs that reduce efficacy, enzyme inducers. Rifampin, rifabutin, antibiotics for TB. Certain anticonvulsants, phenytoin, carbamazepine, phenobarbital, topiramate. Antiretrovirals, efavirenz, ritonavir. St. John's wort, herbal supplement. Drugs with potential interactions, corticosteroids, increased steroid effects. Some anti-diabetic drugs, progestins may alter glucose tolerance. Thank you. Have a nice day.